This is IAQ Radio, Indoor Air Quality Radio, the voice of the indoor air quality industry, with your hosts, Radio Joe Hughes and the Z-Man, Cliff Zlotnick. And now, Radio Joe Hughes.
Good day and welcome to IAQ Radio Plus. This week is episode 634. We are welcome Dr. Jennifer Sahmel and Kirk Phillips. We're going to talk today about total exposure health and total worker health, a somewhat new concept for at least for our listeners, and looking forward to talking to two of the leading experts in that area. Before we get started, we want to thank our sponsors. They're the reason we can continue doing IAQ Radio Plus. Our marquee sponsor is Instascope at instascope.co. Our association sponsors are the American Industrial Hygiene Association at AHIA.org, the American Conference of Governmental Industrial Hygienists at ACGIH.org, the Cleaning Industry Research Institute at CIRIScience.org, the Indoor Air Quality Association at IAQA.org, the Restoration Industry Association at restorationindustry.org, the Institute for Inspection, Cleaning, and Restoration Certification at IICRC.org, and Healthy Buildings America 2021 at HB2021-America.org. Industry sponsors are AEML Laboratories at AEMLinc.com, Particles Plus at particlesplus.com, Grey Wolf Sensing Solutions at greywolfsensing.com, TSI Inc. at tsi.com, Sunbelt Rentals at sunbeltrentals.com, April Air at aprilaire.com, and Healthy Indoors Magazine at healthyindoors.com.
And now you can win a cool prize. It's time for the IAQ Radio Trivia question. Be the first to correctly answer. Simply email your answer to czlotnick at cs.com. Or if listening live, just text your answer from your computer. And now, here's the Z-Man.
Hello, everyone. Congratulations go out to Bruce White, Fountain Valley, California, for identifying detonation of the first atomic bomb in a test at Alamogordo, New Mexico, as the Big Bang that occurred on July 16th. The IQ Radio Trivia question for today, July 30th, 2021, has been sponsored by TSI Inc., an industry leader in the precision instrumentation for monitoring of the indoor air. Learn how to expand your IQ investigations at tsi.com. Here is today's IQ Radio Trivia question. Who was the first scientist to demonstrate that a cancer may be caused by an environmental carcinogen? Back to you, Joe.
All right, thank you, Cliff. Dr. Jennifer Sahmel is a managing principal scientist with Insight Exposure and Risk Sciences in Boulder, Colorado. She's a certified industrial hygienist and certified safety professional with 25 years of experience in exposure assessment science and workplace health and safety. She's worked in a variety of public and private sector positions, including the US EPA's Office of Pollution Prevention and Toxics, the National Park Service, and Comprehensive Health Services at NASA's Goddard Space Flight Center. She earned her MPH degree in environmental health and industrial hygiene from the University of California at Berkeley and her PhD in environmental health at the University of Minnesota. She's also active in the AHIA and is a past member of their National Board of Directors. Colonel Kirk A. Phillips, retired, currently holds the position of Director, Air Force Office of Energy Assurance in Washington, D.C. Prior to his current position, Kirk was Health and Safety Environmental Practice Leader and Vice President at LJB Inc. In 2018, he retired as the BSc Associate Chief for Bioenvironmental Engineering in the Office of the Air Force Surgeon General. In 2014, he developed the Total Exposure Health as a strategic initiative to institutionalize primary prevention in work, environmental, and lifestyle exposures. Mr. Phillips entered the Air Force from a four-year Air Force ROTC scholarship in 1985. He got his BS in aerospace engineering and his MS in engineering and environmental management. Colonel Phillips has held a broad range of leadership positions throughout the Air Force. All right, I did it. I didn't even stumble too bad. So I'm feeling great to have you. Welcome, Kirk and Dr. Sahmel. Sahmel.
Thank you so much for having us.
Thank you.
Great to have both.
Be here.
Let's do a little background first. Let's start with you, Kirk. Tell us a little bit about your current position and some of your current maybe volunteer activities, I guess, with AHIA and others.
Absolutely. So I've spent my career working in the broad areas of environmental safety and health. I was a certified industrial hygienist for 20 years, now mainly doing management and speaking. So I don't continue that. But one of the things about my career is that I really saw exposures in all areas, both work exposures, home exposures, and with my environmental engineering, the environmental exposures. And with that and working in the medical field, I really could see the advances in medicine as well, and where as exposure scientists, we could participate to really make a difference for true primary prevention. I currently lead the office that does all energy for the Air Force and all water for the Air Force. And so I'm still working water quality, but a whole lot more as we right now are moving to the Air Force to be completely resilient in energy matters.
Interesting. Let's go to you, Dr. Sahmel. What's your current position? I know you're managing scientist, but I'm not familiar with insight, exposure, and risk sciences.
Yeah, so my current position is as a consultant, and I work with a wide range of different kinds of entities, governments, and private industry, and other types of entities, as well as trade associations. And really, the work that I do now has been enabled by the work that I've done in the past, which we've really kind of built on over time. I started my career in the government, working as a consultant first, and then as a contractor, as well as a government employee. And through that time, I've really developed a keen interest and experience in risk assessment as it relates to industrial hygiene and all manner of different types of concerns for which we might have a risk or need to characterize the risk. And also the area of exposure science. So understanding how we characterize exposures, how we measure exposures. A particular area of interest for me is dermal exposure assessment. And I have done quite a bit of research in that area. And that's led me to this also interest in research in the area of total worker health and total exposure health. And then also this sort of subset of that, total worker exposure, as that might relate to how we might want to better characterize the holistic or total exposures to both individuals and workers specifically, as it relates to dermal exposures, inhalation exposures. And then, of course, we have this unique, I think, evolution of our workplaces, and especially we've seen this year after the pandemic, that the lines between the workplace and home have really blurred, and we no longer have the traditional workplace that we used to have. And so we do want to be able to consider and understand and characterize what exposures might be to our workers in all of those environments that they're operating, potentially as employees and as official agents of their organization.
Yeah, I think this hits on something that's frustrated indoor environmental quality people for years. You know, we look at somebody's workplace, but we don't see where they're at the other, whatever, 12, 14 hours of the day, maybe 16 hours of the day, they're somewhere else, and we don't get to look at that or even really discuss it very much. So I found this very interesting. It's kind of new, I think, to everyone. Kirk, you developed this concept back in, what was it, 2014? Is that accurate to say?
I did, and it became for the DoD. It became a strategic objective for them, where they realized that they needed to have individuals' health in mind, and that they needed to consider more than just the workspace. And then AHIA had me as their keynote speaker at 2 of their national conferences, at which point after that, they did create a strategic priority themselves. And I've been the chairman of that priority team. And really the idea here is industrial hygienists realize, or AHIA realizes, that we're exposure scientists. There's nobody better than us all, and this is, of course, IAQ professionals as well, to really understand and get after that exposures don't stop at the threshold of the workplace. And if we're really going to serve the community and our society with our skills, we need to really consider what happens before and after. Does not mean that we have to control it, but we have to consider it. And each person, each professional working in their exposure area is able to do a part to consider the whole. And so if one of the things to keep in mind is if all your employer wants is the workplace exposures, that's fine. But professionally, we know we have to consider whether for instance, you have quiet time at night if you've been in a noisy environment. So it's our responsibility even then is to understand somewhat those exposures that are beyond just the workplace. And so with all of these totals, we realize that we all have a place to do what we do in a more comprehensive way.
You mentioned DOD. This story, is this like military-wide kind of concept now? Is the entire military now using this total worker health as part of what they do with respect to health and safety?
So the DoD considers they've had total worker health for a long time because they have social services and psychiatrists and public health professionals and commanders that are all making sure that they're thinking about the whole person concept. And then total exposure health really hit the military significantly when you think about the burn pits and Gulf War syndrome and the realization that there's a lot of things that are happening that are not part of the workday that are exposures. They do move slow, so they are doing it, but you won't see right now. Just like everybody, they're getting this as well as all the other types of things we're trying to get done, fully implemented. And they really look towards AIHA as well. The industrial hygienists in the DoD are saying, hey, AIHA, what is the profession of industrial hygiene? And so that's been very helpful that we're all in lockstep. And I would say other parts of government and industry as well.
Interesting. And then in the military, they also oftentimes control the housing of these folks. So they're already involved in total worker health, whether they like it or not.
That's right. So, I had 10,000 homes I was responsible for when I was in Okinawa. And I did lead-based paint surveys and got called when somebody's drain backed up and they're worried about, the sewage and whether when their child drank something under the sink and needed emergency understanding of what was the chemicals in that something. So there is a benefit when you own a home that somebody's living in and they're also your worker to help with those exposures. But that's not really the norm for everybody, and it doesn't need to be. We really need to just understand that we won't ever control people in their homes, but we don't need to. People want to be healthy, and they really just want information about what will make them healthy. And so asking them a few questions about what they're doing at home and providing them some advice and allowing them to seek people like IAQ professionals to come and collect data when necessary is all incredibly helpful to understand that total exposure and then total health picture.
Let me jump over to Dr. Sahmel. You've been involved with AIHA for a long time, a past member of their national board. How is this going over within the membership, if you know?
Yeah, it's a really interesting question right now. And in fact, we just did a very lively debate on this topic as part of our national conference this year. For those of you who may have attended the national AIHCE conference back virtually here back in May. And there are certainly some significant questions that individuals have, but it's very much a topic of interest and discussion right now. I think what I've been encouraging the association to do, and a number of others as well, is to look at this as an opportunity for expanding the use of all the, as Kirk mentioned, the use of the tools and expertise that we've developed within the association as exposure scientists. And the ability to evaluate exposures is not just limited to the workplace. Of course, the skills and methods that we've developed over many, many years are very applicable to these other types of scenarios. And what we don't want to do is to sort of create the assumption or concern that somehow we're trying to control individuals outside of the workplace or dictate what they should or should not be doing. It's more about this characterization and being able to understand better what those exposures are, how they might be influencing someone's exposure inside the workplace. For example, lead exposure is one where if somebody has a hobby that involves fishing or shooting, you might have potentially measurable exposure to lead, which then would contribute to your overall body burden of lead if you also have some workplace exposure. And so not looking at that holistic picture could make a difference for a person in terms of their overall health. And so I think we really hope that we can start to look at this as an opportunity for trying to use the methods we've already developed to get a better understanding of what exposures are outside the workplace, how they compare between the workplace and lifestyle or hobbies or home, and try to help educate individuals about making their lifestyles healthier, making their families healthier, and really also thinking maybe about the ability to make or have our workers be active volunteers or partners in this process. As Kirk mentioned, everybody wants to be healthier. Everybody wants to have more information about how to become healthier, have a better lifestyle and well-being. And this is a great opportunity for AHIA and for the IAQ community to be involved in that process and to help become active partners in the process of improving all of our health.
Interesting. Why don't we go to the slides now? I see some good chat conversation. We'll get back to that in a moment, but I'd like to kind of just go through the slides real quick and give people a little better understanding of what this whole concept is. Jennifer, you want to run us through this and then pass back and forth between you and Kirk?
That's perfect. Yeah, we'll kind of do this very informally and quickly, and I will, Kirk, ask you to weigh in on a few of these as well as we go through. So I just wanted to point out, obviously, we've got this huge list of this not chemical soup, but this alphabet soup, really, of all these different terms. And I think one of the things Kirk and I, along with a couple of our other colleagues, Deborah Nelson and Chris Lasses Davis, have been hoping to do is to try to help put some definitions and context around these terms that we're seeing thrown around. Total worker health, total exposure health, total worker exposure, and what we're calling the totals kind of as a group. Next slide, please. And so we really do want to be able to help folks understand what these different concepts mean, where we as IAQ professionals or industrial hygienists can really make a difference in starting to promote these concepts, to bring our expertise to the table in evaluating some of these issues that maybe where we've got the blurred lines between the workplace and the home or the community and the environment, and understanding that we do want to understand what people's complete exposures are and how that can really help improve their health. Kirk, is there anything you wanted to weigh in on this slide?
I would just say that on the grouping here, this is the terms, but we're going to show you at the very end of this presentation a really great Venn diagram. So if it keeps being a little bit confusing as we talk about the three different areas, we're going to talk about just weight, and we're going to show you a really great way to put it together by population and then by exposure.
That's great. Thanks.
Next one.
Next slide, please. So here's just a few examples of maybe kind of putting into context what we're talking about here. We've got individuals today routinely working in their home. We see this big, very busy looking office here. And of course, this past year, many people working out of their home all the time, and maybe continuing now going forward, working out of their home 24 hours a day, 7 days a week when they're and not having an office to go to at all. We see individuals blurring the lines between family and work and having to juggle those in a much more potentially challenging way. Individuals now use their car as a workplace on a routine basis, and whether that's just driving back and forth between events or to the office, or being an actual paid drivers, such as through a driving service. And then also individuals who are extending their work life into their retirement and continuing to work more than traditionally was sort of the traditional work lifetime. Next slide, please. So just a couple of other examples, I think, just to help sort of put this notion in context, what we're talking about. These are a couple of examples of some successful, I think, total exposure health programs that we see out there. And so, for example, there are air quality monitoring programs that individual citizens can get involved with. And CitySense is a volunteer program where you can develop a special sensor or have a special sensor that you can put onto your phone. And as you're walking around in your own city or in your own environment, your sensor then is collecting data from your phone and then collecting it and saving it and sending it into a central repository so that you're helping to characterize what, for example, optical density for air quality might be in various areas of a city, both indoors and outdoors, in buildings and outside, so that we can help to fill in those gaps where we don't have traditional measurement data. And there's several programs out there that are doing that, and they're often seeking volunteers and what we call citizen scientists to help them with this process. And so the more that we can engage individuals to help us in a voluntary way, because I think a lot of times folks want to have this data and be more involved in it, I think we've got a great opportunity here to really improve our knowledge about some of these exposures. Next slide, please. The other thing that we know, of course, is that unfortunately in many aspects of health, we are seeing declines in health. For example, we have fewer people today reporting that they consider themselves to be in excellent health. We have limitations in mobility that we're seeing more than we used to. Individuals who are more limited in their functional capacity or ability to work. We see obesity increasing. We see exercise decreasing. So many different, I think, trends that could be concerning that we could help to address with some of these programs. Next slide, please. So we want to just really think of this as one of the pieces of the puzzle in helping us to better enhance and improve the well-being of workers, whether they're in the workplace or outside, and looking at ways to partner with our workers as active volunteers to want to become more engaged in this process. Next slide, please. And, you know, a lot of you as IAQ professionals are very familiar with the traditional hierarchy of controls for industrial hygiene. And we wanted to just point out that there are ways to, similar, just as we would for other more traditional stressors, chemical or physical or biological, we can also use this to approach well-being. And so we want to be able to eliminate threats to well-being or do substitutes, health-enhancing policies, redesign workplaces where possible or where needed for improving well-being, and then of course education and personal change. So we can look at this in a very traditional way with industrial hygiene as well. Next slide, please. So, and then I talked a little bit about this notion of total worker exposure, which really we've only defined in terms of, obviously it's just a subset of the total process and a subset of what Kirk has been focused on and talking about, but it's the area that we as professionals, working professionals in this field, can maybe have the most impact today. So, but we know that there's a pretty big opportunity for that with mobile workplaces, again, working from home, subcontractors, where that line is really blurred between where the workplace ends and the home or community begins. And then also we really have this opportunity and maybe even also a responsibility to try to implement these programs that will positively influence health and help workers become more understanding of their total exposures, both inside and outside the workplace. Next slide. So again, we want to be thinking about where can the IH or IAQ professional specifically contribute? Well, we certainly can't be, total worker health professionals. There's also medical issues and policy issues related. We also can't necessarily own the whole notion of total exposure health because we have other types of exposures that we really can't control and don't necessarily want to control for our workers, but just so we can be able to help them. So we want to be able to start to think about expanding our ability to help the workers in psychosocial factors, in stress factors, organizational factors, and other ones that we haven't maybe traditionally considered as professionals in this area, and both affecting change and improving worker health. Next slide, please. So there are some complexities here, and I think this is where when I alluded to the debate that that was at the conference, the AHIA conference a few weeks ago, there's some important questions we do want to consider here. For example, is it unethical to collect sampling data for workers outside the workplace? But on the flip side, do we have an ethical responsibility to collect this information and share it with our workers? Again, in a way that's voluntary and confidential and appropriate. And then also, if we do have sampling data collected outside the workplace, how could we use this data? How should we use this data? And on the flip side, how should we never use this data? And how should we let everybody know that it will be protected and the things that we would never do with it? And then finally, what kinds of roles or actions of the industrial hygienist or the IAQ professional and employers could best serve the workers and their health overall?
I think those
next question.
Some questions we're going to have to come back to in the second half.
Wonderful. That would be great. And so I think, there's some great ethical principles that have been published on these topics. So I think some of the things we want to really focus on are that these programs should be voluntary and not have mandatory participation, especially when we're talking about outside the workplace. But I think we also find that there's lots of workers, and especially some younger workers, based on recent studies, that do have a very keen interest in participation in these kinds of programs and a real interest in understanding more about their health and well-being. And so transparent data use is critically important. What we will and won't do with data, how we're going to protect data and keep it private when it's appropriate to do so. How we're going to use validated technologies so that the data we do collect are correct and accurate and useful. And then how we're going to limit data collection and not collect things that might be excessively personal in terms of information. And then of course, finally, secure storage, how we're going to make sure that we keep these data secure and safe from improper use or distribution. Next slide, please. And I think there, and let me just give you one last quick thing here. Just wanted to give you some examples of what these programs might look like. And just again, to give some more context to these concepts. So there's a number of companies out there that have done various types of programs or created various types of programs to really focus on these questions and to help start to collect data on wellness and total exposure health. And so there's some great programs that are currently ongoing that might be good examples for you in the audience if you're looking for ways to get some more information about these programs. Next slide, please.
Thanks, Jennifer.
And that's it. I'll switch to Kirk.
Thank you. So very quickly, some of the comments that are coming in, I think people are realizing these critical observations right now. There are fewer and fewer exposures in our workplaces today that are acute. And it's more chronic or long-term or low-level exposures. And here's the great thing, that we weren't able to impact that in the past and couldn't understand it very well from a population standpoint. And that's because these very low exposures have unique components to individuals. And we're learning about that through all the incredible research that's being done on the human genome and the advanced sciences with the Internet of Things and medicine, and essentially the fifth industrial revolution. And so we will be, and we are already being asked to help answer. And as an IAQ professional, you're being asked to provide some exposure data where the classical understanding of what's an overexposure by a population doesn't seem to cause an impact. This is where we're really changing the thing here. We're really saying, you know what, maybe most people aren't reacting, but some people will, and it's real, and their body's having a real effect from these lower exposures. And so relevancy wise, as we have fewer exposures in the workplace and the overall exposure profile of a work day becomes important to health, we have a way to continue to really apply what we do as professionals and make a difference. Next slide. We're talking very fast. There's a Total Exposure Health, an introduction by CRC Press. I was involved with this. It's a great book for you to get a primer to learn about this if you're interested. I get asked all the time, how do I find out more? And that's the best way. Next slide. One of the observations is you can't have a healthy population if you just are worrying about people that are ill. You've got to go in there and prevent the disease. And you need buy-in. You've heard Jennifer saying, hey, people need to voluntarily sign up. That's right. You know, one of the things I say is you can go to the doctor and say, I think my arm's broken. And the doctor can say, okay, great. We'll give you a cast. They don't have to necessarily do an x-ray, especially if you don't want x-rays. But you might not get the same kind of medical data and medical care. Same thing with a CAT scan or an MRI. We all make choices in life about how much data we want before a decision's made. And that's the same way it is in exposure. We'll be able to voluntarily decide how detailed we want. Do I want to know if I'm susceptible to an exposure in a way that's different than others? If I want that, I can get that. I can buy that on the web these days, and it's getting better and better all the time. And then am I going to want the people that are out there supporting me to be able to do something for me? And that's where we're moving to in the future, and how you can become a part of this. And I think we aren't going to be changing those population numbers because they're population. Those will still be the published EPA and OSHA standards. But we really are getting after health here. And where do we need to do something for somebody who's unique? We're all unique. We just have to figure out where we're unique. Next slide. So next slide. This one builds. So go ahead and next slide. So we've mentioned, one back. So we've mentioned it needs to be your work. We need to think about lifestyle, environment. Clinical is another one. You know, the drugs you take, the x-rays you get are some of the largest exposures you get in those categories ever. So we need to think about those as well. Next slide. So it really is everything. But we used to have a doctor in the center of this picture, but it's really the patient or the consumer or the person you're working for. They want good health. They're looking on the internet. They're asking about their physician, about what it is. They're buying a DNA test and having it measured. They're buying their own biosensors. I've got mine, right here, and a couple others. And Jennifer talked about your phone being able to be used as a sensor. So they are seeking health. This is a great thing for us. Next slide. So if people have an understanding of where they're unique, great, we can help them more. If not, can we understand where they might be getting low-level exposures that could be impactful? Great. We put those together with them and let them tell their physicians that information. They're going to be able to do things we never thought of before. Pre-exposure prophylaxis, for instance, a drug that helps you have a lower overall risk to hearing loss, for instance, is available and on the horizon. Next slide. So next slide. It's going to build here a little bit. So we have a standard exposure curve. We have an OEL. Next slide. And of course, we have that area of no effect, and then, the one with increasing effect, and then beyond that. And what we realize is that in this picture, back one, in this picture, Al having an exposure. Oh, wait. Okay, Al, if his response at that very low exposure is that high, Al's not being helped by our current methods. Lily and Kirk being helped great. Rick, wow, has a greater exposure. These are the people that complain about indoor air quality and everybody else says they're fine. And we go, oh, well, Rick's not being truthful or he has something else. No, Rick's different and he needs to be treated differently. And then there are people like Ann down there who could be in an environment none of us would want to be in and have little effect at all. So we need to realize that the population curve handles the population, but individuals are individuals. Our noise standard, if you don't know it, was set to protect only 70% of our population, 70 to 80%. And that's because we couldn't set noise low enough to protect everybody and still have industry. And so we knew the curve doesn't fit everybody. And in the past, we couldn't get after it. Now we can get after it better. We can find that population and do something for them. Next slide. So in the past, we thought of only limited exposures. Now we can ask more questions. We used to only have limited sensors, but people are buying sensors and we can access them well. And we had paper records. Now we have expert systems looking at these connections, which are going to give us great insights. And we used to think about only trying to do something about prevention from a post effect, like you already have some disease, but now we're getting after true prevention. Next slide, and we're getting close to being done here. So at these personal exposure monitoring, people are buying them, they're connecting them to the internet. You can ask for this information. It's very helpful to understand with their permission what their exposures are. Next slide. Also, your equipment and others that are using equipment like you use are often enabled and connected to the internet. As Jennifer said, there are programs that are gleaning this information as well, and we can understand what are some of the true background. Is their house well above background for their community? We could find that out, which is important. Next slide. So the benefits are we're really positioned to do exposure in a way we've never been able to do. We're going to improve health outcomes. We're going to be able to have small, cheap sensors that we can get far more data. And we're going to be able to impact this genetics research to go after things that are most interesting to us versus the next thing that's interested to a geneticist. Next slide. So we're going to make a difference together, and that's exciting. Next slide. And I want to just show you now, if we think about health, the outer square on this is healthcare. That's everything you can think of that fits into health. The smaller, same shaped rectangle is preventive health. And within preventive health, some of that can be precision medicine, and a lot of it is not precision medicine. But most of it can have some exposure related component. And that's that circle, that's exposure health. Like I said, you've got lifestyle, environment, work, and clinical. And some of that is just preventive. Some of it is preventive and precision, like with genomics. But no matter where you are, you can just, with prevention through exposure science, you can get after some of these exposures. Next slide. Now let's talk about populations. Who's being helped by us? Well, from an IAQ community, this is awesome because you're oftentimes helping far beyond the worker. But if you think of the working population, that's the dark colored purple. That working population is somewhat being helped. Total worker health, for instance, helps that population. But if they don't have an IH, then they're not getting the exposure piece in the same way. But there's a whole bunch of our population that the non-workers, the children, the retired and elderly, they all are having exposures as well that impact their health. And we have IHs working as IAQ professionals, as an example, in many of these areas with these populations. They are all included under total exposure health, where they wouldn't be included under total worker exposure or total worker health. So this is great because when you think of the totals, you can find where you work and which of the concepts will apply to the kinds of things you're going to want to do.
Interesting.
Next slide, and I think we're done.
That was it. Was there one more? Nope. All right. So what I'd like to do here, we're going to stop. We have to thank our sponsors, our halftime. We'll be back in 2 minutes, and we're going to follow up on that excellent presentation with Dr. Sahmel and Kirk Phillips. Our marquee sponsor, Instascope. More jobs done faster with the future of IAQ assessment technology. Unlimited samples, instant results, and cloud-based data at instascope.co. Our association sponsors are AHIA, Healthy Workplaces, A Healthier World at AIHA.org. ACGIH, Advancing Careers of Professionals in Environmental Health, Industrial Hygiene, and Safety, interested in defining their science at ACGIH.org. The Cleaning Industry Research Institute. See more deeply through science and research at CIRIScience.org. The Indoor Air Quality Association, promoting the exchange of indoor environmental quality information through education and research at IAQA.org. The Restoration Industry Association, the granddaddy of the restoration industry, network with leaders at restorationindustry.org. The IICRC, a nonprofit standards development and certifying body for the cleaning and restoration industry at IICRC.org. And Healthy Buildings America 2021 in Honolulu, Hawaii, November 9 through 11 at hb2021-america.org. IAQ Radio industry sponsors are AEML Laboratories, free shipping, great pricing, same-day results with no rush fee at AEMLinc.com. Particles Plus, feature-rich particle counters and air quality instrumentation. Count on us at particlesplus.com. Gray Wolf Sensing Solutions, over 20 years manufacturing accurate, reliable IAQ instrumentation for portable, short-term, and continuous monitoring at graywolfsensing.com. TSI Inc., an industry leader in precision instrumentation for monitoring indoor air. Learn how to expand your IAQ investigations at tsi.com. Sunbelt Rentals, availability, reliability, and ease for all your IAQ and restoration needs at sunbeltrentals.com. April Air, healthy home at aprilaire.com. And Healthy Indoors Magazine, a free online magazine for industry professionals and consumers at healthyindoors.com. All right, we're back for the second half of our interview here. And what I'd like to do is first ask a question, then I want to go into some of the texts that came in. But you both worked a lot on this. What attracted you to this concept to start with? Let's start with Dr. Sahmel.
Yeah, so for me, as I mentioned just briefly, but I can get into it a little bit more, is that I became very interested in this question of the holistic exposures that individuals might experience, in part because of the work that I've done on dermal exposure assessment and really observing that while we do have a very, in many cases, a very good understanding of inhalation exposure potential, and I think there's been many good efforts over the last many decades to reduce the potential for inhalation exposures, we don't have quite the same level of understanding and expertise as it relates to dermal exposures today. And so that's really potentially an incomplete part of our total exposures when we don't look at this full picture of the opportunities that we might have for exposures. And so as part of that, it's led me to this real interest in understanding this more holistic exposure potential, understanding for exposure science purposes, how we might measure and evaluate all of those exposures, how they might interact with each other, as Kirk has talked about. We know we have many questions with respect to mixtures or multiple exposures from multiple chemicals by multiple routes. And it's really, I think, a great opportunity for us, again, as Kirk also talked about, to really better understand the influence of all these different exposures on worker health, the differences in those kinds of exposures to different individuals, and to really advance our understanding and knowledge. And we really are now just on the cusp of this tremendous opportunity with technology to be able to do that in a much more effective way. And then the other thing I think I want to mention is that I think we've done a pretty good job in many instances of effectively reducing worker exposures. And sometimes now those exposures in the workplace, which maybe historically many years ago would be much greater than what we would see in the general community or environment, are maybe now equivalent with some of those exposures. And so those consumer or environmental exposures are relatively often more important than they used to be for total exposures to an individual.
Okay, and Kirk, was there an incident or an issue or a concern in the military or elsewhere that led you to start the development of this?
Yeah, there were actually a number. I'll say the first one was risk to relevancy. I was asked the question multiple times, demonstrate where you've made a difference. Show me the population that, because of your work, is better off today. And as we did, as Jennifer said, we've reduced these exposures. It was very difficult to show that we had relevancy. And I realized by a video I watched about Humans Need Not Apply that those jobs that have the greatest exposures are the ones that are most likely going to be eliminated out of our workforce. And so there's a true relevancy of occupation. And I began to say, well, I want to make a difference in the world. And I think a lot of people feel that way. So what's the real situation? And what we saw is there's still a significant number of people that are getting ill through preventable diseases. And that means that we are taking care of the masses, but since everybody's unique, everybody has something they're at risk to. And I began to read up on genetics and understanding the modern science and the way our bodies are responding, and realized that it was moving forward without a strong presence of an exposure scientist. They were just working on whatever was the neatest thing. So one of the things I read, which was very impactful to me, was the reason why we know about the BRCA gene for breast cancer is because it costs only about $10,000 to remove a breast, but it costs $1 million to treat breast cancer. And so the insurance companies paid for the gene research to make that part of our purchasable gene information. And it wasn't because they care about women and their breasts. It was because they don't want to spend $1 million when they could spend 10,000, even if they have to spend 10,000 on a lot of people. And that's a lot of people that are having a very invasive surgery that is, preventive. And I said, wow, you know what? There are a lot of people being exposed to things that we could get after. I'll give you an example. The BRCA gene is a 1.7 risk ratio, meaning 70% increased risk. The genes we've identified in risk to sprained ankles has a 5, meaning 5 times fold greater risk of a sprained ankle if you have a particular gene. And for noise, we have a gene that makes you 27. The risk factor is 27. So it's 27 times more at risk of hearing loss when you have this particular gene. These are far greater than 1.7. And so I realized that why not participating society was moving in the wrong direction. We have information that is desperately needed by the latest in the medical fields and the genetics fields.
I wonder if I have that ankle and hearing genes. I don't know. I think I might. I want to go to a text, and then I want to give Cliff a chance to jump in here. The text is there is a slippery slope here. Yes, exposures outside of work are important to consider, especially in caring for patients with occupational illness. But some may look to environments other than the workplace as an excuse to make necessary improvements to the work environment. How do you address that concern? Either one.
So we want to go first, Jen?
No, go ahead, Kirk, and I can chime in.
All right. There's those population-based exposure requirements and what a workplace needs to do, an employer needs to do to provide a minimum healthy environment. Nobody's advocating for that to change. They will still need to meet that. That does not mean everybody will be able to maintain their health in that environment. So I don't really see it as a slippery slope. It's more that buying into either the low or the high level of protection. And so from a workplace, they're going to need to provide a minimum level. And as an individual, you need to be able to seek out from professionals, somebody to provide services to maintain your true health.
Okay. Jennifer, anything you'd like to add?
I think that's right. I agree with Kirk. I think that we need to be looking at this both as an opportunity and responsibility, as I talked about before, and obviously treading carefully in terms of personal information and privacy, and looking at, I think, systems that we're going to use to provide, I think, a level of comfort to the worker that they are not going to have their information used in a way that wasn't anticipated, or that they weren't anticipating, or that they didn't agree to. So there's certainly some very important ethics, I think, questions that need to be answered. And one of the suggestions that we've talked about in some of our other presentations and programs is to develop a framework around which you're up ahead of time telling your workers, here's what we'd like to collect. If you'd like to volunteer, we'd love to have your participation. Here's what we will and will not do with your data. And so here's some comfort you can have up front. We've thought this through. We're being very careful about this, but we're doing this to try to improve health, to try to improve well-being, and we care about our workers and want to make a difference beyond just the minimum, OSHA standards or ACHIH standards.
All right, let's go to the roundup, John, and we'll get a last question for Cliff, myself, and then give our guest the last word. The Roundup is brought to you by April Air, providing healthy humidity, ventilation, and air purity solutions for new and existing homes. April Air, healthy home at aprilaire.com. All right, we're back for the roundup. Cliff, I want to turn it over to you real quick. I don't know if you want to do one of the texts.
No, I want to do my own question. It's really not my own. I'm a volunteer on a committee that's writing an international standard on fire damage restoration of buildings. And certainly we are interested in protecting workers. And typically what's done in these buildings after the fire department puts it out is the buildings are ventilated. Then we go in and we clean. The workers are wearing personal protective equipment. they'll wear, good respirators, good gloves, Tyvek, depending on how soiled the environment is. And typically we just wash the interior of the building with soap and water. And soap and water is recommended to clean a lot of things, pesticides and some other hazardous materials. And the question is whether or not we should be doing aggressive testing of these environments prior to cleaning them. And if we did that, it would cost time and it would cost money, and it would be difficult sometimes to separate what was in the background and what is actually fire related, which would really be the insurance company's responsibility. So I know it's a big question. I know it's a big topic, and I'm just looking for a little more information or guidance or suggestions from you folks. What would you do?
Kirk, you want me to start on this one?
Sure, it would be great.
So I think just briefly, I think it would depend on a number of factors. For example, is anybody currently occupying that space, or would they need to occupy that space before the cleaning would occur? So that would obviously be an important consideration. But as we've talked about today, if we do truly want to understand or characterize the total exposure to an individual, we might want to know something about that environment before the cleaning occurs and after, so that we can, number one, demonstrate the value of the cleaning process, validate the methods we're using for the cleaning process, and demonstrate that that at the end of the process, we're at a point where we've sufficiently controlled or eliminated exposures. And I'm thinking, of course, especially about dermal exposure. So maybe we've gotten a significant amount of the materials that might become airborne, but maybe there's still residual materials on surfaces that could, over a long period of time, still produce a potential for dermal exposures, for example.
Okay.
Kirk, would you like to add anything?
So I think the key words I heard from Jennifer, which I would definitely agree with, and that is, if you need to demonstrate the benefits of what you're doing, that then the pre-sampling, and then the post-sampling is going to give you a standard to measure against from a population standard. And we have experience in this. You all have experience in this, and sort of what's good. And we would want to show that we were meeting those standards amounts and below those published exposure limits. It also would provide a data point if there was something that was long-term, low-level, that would impact a small segment of the population. You would have that post-sampling knowledge to be able to provide to a practitioner if they were to ask. So I think that's a valuable data to have.
Well, the question is, what would you test for? Because you don't know what's in there. Typically, when we're testing, we're looking for something specific.
So so it's a difficult question today, but I've got good news on the horizon. Been working with the University of Utah with developing a GC mass spec system, and that you say, oh, really? Wow, that's amazing, right? But it's also going to be the size of basically a noise dosimeter. So, it's using microfluidics and can measure all organics simultaneously. So, the future of total exposure and the micro sensors and the technologies that's moving is that we're not going to have to ask the question of, wow, I can't spend $100,000 to understand what all the potential exposures, because when you burn something, depending on the temperature,
Right.
Almost any organic can be produced, right? So it could be anything. So the answer right now is, you're right. You'd have to look for a few carcinogens, maybe dioxin, that kind of thing, maybe PCBs if electrical fire or something. But in the future, and not far from now, you're going to be able to hang like a 3M badge, something that's going to give you nearly every organic chemical simultaneously, and it won't be that expensive. So I think we'll find a better answer in the future.
How soon and how much would that thing cost, do you think?
It's going to, we need to wait.
Okay.
All right. I got a question from our audience. Does your concept of total exposure put a central focus on cumulative and synergistic low concentration exposures to a complex mix of chemical and microbiological contaminants? I'm not sure I quite get what we're getting at there, but maybe you do. Kirk?
The short answer is if that is where your profession is, total exposure health absolutely does that. That is on the farther end of being able to get after the totals. And I think that's great that you're thinking that way. You would not be able to fully practice that today, but you could practice it partially and total worker health as well. Because, when you ask somebody about their stress, you're addressing whether their microbiome is going to be impacted and the chemicals it produces in the body. When you think about long-term, low-level exposures, that's one of them, and as well as the external ones as well. And so absolutely, that is where exposure science is going. Today, I think you aren't able to fully achieve that, but you can always ask the questions where I believe somebody might be having an impact.
Dr. Sahmel, you want to add anything?
Yeah, I would say that's absolutely, as Kirk says, the direction we're going with exposure science. And we really have overall relatively little information about these effects of mixtures, low-level chemical exposures over a wide range of chemicals, and the synergistic potential effects. We really do not have enough information about this today. And I think we're on the cusp, as Kirk is saying, of being able to really start to collect more information to start to understand some of these relationships. We do have some relatively rudimentary ways to evaluate through exposure science, the effects of mixtures. We can look at, relative chemical activity of different chemicals and mixtures, but we're just scratching the surface of that. But it's absolutely the direction we want to go. And I very strongly encourage that we, part of the reason that we do want to collect this data is to better understand some of those questions.
And if I could add to our answer, I think it might even be a really good sort of end of the show-ish kind of a thing, and thinking about the future. If you think about toxicology being, rats being exposed to chemicals or mixtures of chemicals, and then figuring out how many of them have some sort of an effect, that's not the way toxicology is done today. Today, they look actually at human cells that we can expose them. We can see how those cells respond, and that's genetically turning on and off different genes that produce all the kinds of chemicals. They then look at that chemical cascade that turns on and off additional genes and get after what is the final products being produced out of the cell, that's molecular biology, to understand how that can impact organs. And so the future of being able to understand how exposures impact our bodies is no longer looking at that. They are already today doing toxicology this way. It's called computational toxicology. And it is providing us as practitioners of exposure science information that allows us to get after these low-level exposures and understand how they can be impacting the body very specifically and very early, far before we see damage in the body. And if you're in the research area or influence the research area, providing the types of exposures that you believe people have in this low-level mixtures is what the computational toxicologists need in order to give us back the data that we're going to want to have. And once they know what we want, they'll produce it. There's tens of thousands of people working on that worldwide.
That's a great point, Kirk. I'll just add briefly that's where that missing link then of understanding what those exposures are will really add to that. So we know what the effects are, and then we understand what the typical exposures are. That's the key to this and really understanding it.
Before we go, start with you, Dr. Sahmel. Anything you'd like to add? Anything we missed? Final thoughts?
I just wanted to just say thank you so much for having us today. I do think this is really the future of exposure science. I think it's a great opportunity for us as practitioners, and I hope that all of you participating today or listening will look at this topic a little further, do some research, and try to get involved in helping us advance this notion.
Kirk Phillips, final thoughts?
Whether you're an environmental engineer, an industrial hygienist, a health professional, or somebody that's an indoor air quality professional, a mold specialist, you are all exposure scientists. And as exposure scientists, you hold a very important piece of this pie. And we together as a group are going to really have a terrific future.
All right. What I'd like to tell listeners, we're going to capture this chat, and then we'll run it by our guests after the show. And if there's anything we can add, we will do so. But I want to thank this week's guests, Dr. Jennifer Sahmel and Colonel Kirk Phillips. Great job. Total worker health, total environmental, or total exposure health. It's starting to come into focus a little better for me now, and I appreciate that. I also want to let listeners know next week we're going to have a ACGIH show. We've got Jack Springston, the ACGIH Bioaerosols Committee Vice Chair, Neil Zimmerman, the ACGIH Industrial Ventilation Committee member, and Frank Mortal, their Executive Director, is going to join us next week. We're going to have a great show with the folks from ACGIH and talk about some of their new publications coming out. There's a mold publication that I know a lot of our listeners will be interested in. So this is Radio Joe Hughes saying thanks to this week's guest. Thanks to my co-host, the Z-Man, Cliff Zlotnick. John, you got to have faith at the controls. Most importantly, our growing group of loyal listeners and our sponsors. We'll be back next Friday at noon with the next episode of IAQ Radio Plus.
For IAQ Radio, I'm Spike Reel saying thanks for listening.